Hello everyone, my name is Sam. I am a GP. Today I'm just going to present on a topic called chest pain. Chest pain is a very common presentation to general practice. So it is very important for anyone who is interested in becoming a GP or any medical practitioner who works in an emergency to understand the different causes of chest pain. Let's begin. As you can see here, this is the anatomy of the human body. Okay, so other than the skin, the fat, the muscles, and the rib cage, we can see that there is under the rib cage, there is the heart. There is the lung, one on the left and one on the right side of the heart. And the esophagus, which is behind the heart. The thymus gland, which is behind the sternum. And the gallbladder, which is behind and below the liver. So this is my approach to history taking when a person presents with chest pain. Essentially, the step one, okay, is to think about the internal organ and surrounding organs first. This is because any pathology in the internal organ can be life-threatening. Obviously, most people, the first thing they think about is the heart. Okay, so different processes can affect the heart. I have also my own approach to looking at the different processes that can affect the heart. And I use the mnemonic called INTO. I for infective or inflammatory, N for neoplastic, T for trauma, and O for obstructive or compressive. So the heart, generally, if somebody who is senior, more elderly, presented with chest pain, you have to think about the obstructive process that affects the coronary artery. So this would include, things like angina, unstable angina, and myocardial infarction, essentially a heart attack. Infective process can also affect the heart, mainly pericarditis, which can also present with chest pain. Closely related to the heart is the vasculature. So somebody who's come in who is senior, you have to think about aortic dissection as well. Okay. The next step that we have to, think about is the organ. Okay. Around the heart itself. So essentially the surrounding organs. As shown prior, we have got the lung, and different processes can affect the lung. Infective process, okay, include pneumonia. Neoplastic process include lung cancer. Obviously with invasion causing pain, trauma, okay, causing pneumothorax, can also present with chest pain. An obstructive process in the vasculature of the lung would cause something called, pulmonary embolism or infarction. Behind the heart, we have got the esophagus. Okay, the esophagus, okay, generally doesn't have much pathology to do with it. Generally, the most common one that causes chest pain is esophageal spasm, secondary to gastroesophageal reflux. The next organ we look at is the gallbladder. Okay, gallbladder, gallstone can cause biliary colic, which can also give you chest pain. And I have seen patients that present to myself with chest pain that was finally diagnosed to have thymus gland tumor, a thymoma. So these also need to be taken into consideration as well. So other than those internal organs that we talked about early on, you have also to think about the different layers of the body. Okay, we can go from the external layer, which is the skin. Some people present with, herpes zoster. Can present with chest pain. Okay, and cellulitis, which is a infection of the skin that has spread into the fat layer, can also present with chest pain if it happens on the chest. Similarly, traumatic process, including strain, tear, sprain that happens on the muscle after a heavy workout at the gym, can also cause chest pain. And finally, any traumatic process, trauma to the bone, to the sternum, the ribs, can also chest pain causing either a bruise or a fracture. With experience, I think a lot of practitioners will be able to assign the different condition to the different age group of the patients that present to either the emergency department or to the general practice. Okay, so it is a good idea to look at the population group, whether it's a child, adolescent, adult, or senior adult, to decide what is the most likely condition affecting them. Obviously, this is not an exhaustive list of conditions. It's just a common differential that we have to think about. Okay, and this video has been made available for information and educational purpose only. It's not intended to diagnose, treat, or cure any diseases. It's not to be used as a substitute for professional medical advice, diagnosis, or treatment. Thank you very much.